Okay, round two. Name something that's not boring.
A laundry? Ooh, a book club. Computer solitaire, huh?
Ah, sorry, we were looking for Chumba Casino. That's right, ChumbaCasino.com has over 100 casino-style games. Join today and play for free for your chance to redeem some serious prizes. ChumbaCasino.com. No purchase necessary. Void where prohibited by law. 18 plus terms and conditions apply. See website for details.
Lucky Land Casino, asking people, what's the weirdest place you've gotten lucky?
Lucky? In line at the deli, I guess?
Aha, in my dentist's office. More than once, actually.
Do I have to say?
Yes, you do.
In the car before my kids' PTA meeting.
Really?
Yes.
Excuse me, what's the weirdest place you've gotten lucky?
I never win and tell.
Well, there you have it. You can get lucky anywhere, playing at LuckyLandSlots.com. Play for free right now. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18 plus. Terms and conditions apply. See website for details.
Handle with Care, Cancer and Beyond is a podcast that gives everyone and anyone a place to come and keep it real about their cancer experience. Welcome to Handle with Care, Cancer and Beyond.
Welcome back to another episode of Handle with Care, Cancer and Beyond. My name is Chris Donovan, the co-host and producer here with Carrie Madrid of thecareprojectinc.org and carriemadrid.com. Today on the show, we have a really cool guest named Mark Brown. Now, Mark Brown is an oncology nurse and the CEO of Ultimate Vitality. Now, being the CEO of Ultimate Vitality, he created Dermavitality. Dermavitality is a natural, organic, plant-based skincare for patients formulated by Mark Brown, the oncology nurse and a cancer thriver. Clean skin care designated to soothe, calm, and hydrate your skin during chemotherapy and radiation. There's been tons of reviews on there. Patients and nurses alike love the product, and they are the sponsor of this episode. So if you want to get more information on them, you can look at the description of this episode, click on the link, or just go to dermavitality.com, DermaVitality.com. Mark talks about why he created this with his partner and the next steps that are in the future for Dermavitality with some clinical trials. It's a really fascinating conversation. Please sit back, relax, enjoy this, and go to thecareprojectinc.org for more information on the Care Project or Carrie Madrid. And make sure you go to dermavitality.com too while you're listening, because you're going to be impressed. Enjoy this conversation with Carrie Madrid and Mark Brown here on Handle with Care, Cancer and Beyond.
Hey everybody, we're back with another edition of Handle with Care, Cancer and Beyond. My special guest today is oncology nurse and the president and CEO of Ultimate Vitality, Mr. Mark Brown. Hi.
Hi, how are you? It's nice to be on the show.
Yeah, I'm grateful to have you. We had your business partner, Leslie Nygaard, on previously, and we talked a little bit about the products. And so I wanted to hear from you as the oncology nurse, half of that duo. She is also a breast cancer thriver like myself. And so together you all created some amazing products specifically for oncology patients. So we'll get to that in a minute, but first I want to know a little bit about your nursing background and how you ended up in this space.
Yeah, so I kind of have been everything nurse. When I was practicing, I practiced for, over 20 years, and I was an ICU nurse and a flight nurse and an HIV nurse. I worked in a lot. It was nice because nursing allows you to kind of move. And if you get bored in one spot or it gets too stressful, you can move to another spot. And then, eventually I landed in oncology, and I really found it, meaningful because you develop, it's good and bad because you develop very meaningful connections with people.
Absolutely.
And it's really a privilege and an honor to help people and guide people through this most challenging and stressful time in their lives. And so I found that, really rewarding. You do a lot of the technical stuff, but mostly it's just connecting with patients and maybe helping them shift their perspective a little bit, or provide them resources to help comfort them. And, it's not one of those where you see the patient and then they just go home, because they come back. And so, you see them for 4 weeks to 6 weeks, and maybe they go home and they've, been treated, but maybe they come back in a year because they relapse, and then you still know them again. And so that can be even, that can be the difficult part, is that you actually become kind of friends with people.
It's true. I can say that from the patient's perspective. I
Yeah.
was devastated. I became attached to I loved all of my oncology nurses that I had, but it seemed like because once you get into a schedule of chemotherapy, you're usually on the same exact time slot, roughly. And so you see the same nurses on the same shifts often. And I really became attached to them in a way where, although chemo was like the most scariest thing to go through of all of my cancer experience, it in some way, shape, or form, when I saw their faces, I knew I was in good hands and I felt protected, if you will.
Oh, that's nice. That's what we like to hear as nurses, you know?
I think listen, I've experienced ICU nurses when I became septic and was hours from death. I've experienced labor and delivery nurses having my kids. I've experienced all types, and I could never do the job, although that was my desire when I was a young girl. I wanted to be an ER nurse so badly.
Mm.
But there is something special about oncology nurses. And I think it is just what you just said. It isn't like you see them in the doctor's office, you treat something that happened or even an accident, and then you send them home and they're fine. These are people that are on the brink of death oftentimes.
Yeah.
Something different about that.
Yeah. Like I said, it's kind of like a privilege and an honor to be there for them and to be able to make a difference in their lives, and in their families' lives ultimately. Because,
Yeah.
like, as nurses, like, all we really want to do, we want to help our patients feel better. We want
hmm
them to have less suffering and be more comfortable. And so, when we can do that, that's very, meaningful for us.
You know what else I found with chemo nurses? Like I'm flashing back. I'm probably going to do this our whole conversation. Um, is the education. So the education piece that you get specifically for chemotherapy, and even when you're going through your radiation planning, right? I mean, there's so much education that goes into it. I'll never forget my first um, chemotherapy was 8 hours. I got 3 drugs all at once, or back to back in one setting every 3 weeks. And so we got there at like 7:30 in the morning and had education till at least 8:30. I mean, literally education, videos, questions and answers and pamphlets and do's and don'ts. And it's so overwhelming. And then you sit down and you have the actual infusion, and then they're checking on you after. But the educational piece that comes from oncology nurses specifically, invaluable.
Yes. Yeah, and sometimes, it's really good to be prepared. There are some drugs that really kick your butt. And so it's good to let people know that, hey, when you get home and maybe tomorrow, like, and it's going to get a little worse. And,
Yeah.
we can't really sugarcoat it because we want you to know, like, it's kind of going to be a butt kicker,
Yeah.
really.
Right. But I appreciated the nurses that kept it real with me, because I am a firm believer in keeping it real. And I think you can do so with tact and with sensitivity so that you don't scare the crap out of them, but
Mhm.
that you also don't want them coming back ticked off that, hey, Mark, you didn't tell me it was going to be this bad, right?
Right. Yeah. No.
So I think that's really important. My nurses used to tell me, okay, look, even though you feel a little weak right now, you're going to feel pretty good tomorrow, but it's the day after.
Yeah.
And then
Right.
when I had to learn to give myself the shot, right, that boosted my white blood cells or whatever, that was a whole other thing. But so you've got a ton of nursing background. Are you still
Yeah.
practicing today?
No, I don't practice now. I'm just
Okay.
really engaged in, growing our company, and I'm I'm still kind of involved with nurses because our primary mechanism for getting these products out is to
hmm
send the nurses and the doctors samples. So
Yes.
what we do is we just start trying to get our products in the hands of as many nurses and doctors as we can.
Right. So tell me, how did you get, well, first of all, what's the difference between Dermavitality and Ultimate Vitality?
So Ultimate Vitality is kind of our vitamin and supplement line, and we focused on, products that are highly bioavailable. You know, as a business person too, the vitamin and supplement space is very competitive, and we're not a huge company. I mean, it's Leslie and I and a few people that help us.
Mhm.
And, Leslie really helped as a naturopathic nutritionist. She's helped kind of put together the supplements that we felt that would really be valuable for patients after chemo and help them kind of get back to their former selves to decrease inflammation, vitamin D levels, a lot of the other kind of important things. But it is a little tricky in the oncology world because, we don't, in general, they don't recommend to take supplements while you're having
I
chemotherapy.
was just going to ask you about that because a lot of our patients that come through the Care Project, my nonprofit, they will ask that in our socials, like, hey guys, my doctor said I can't take vitamins. Do you know why? And I've never really known the answer to that. Why is that?
So there's a couple things. So the antioxidants in particular can interfere with some of the chemotherapy.
Oh,
And
okay.
then if we're boosting our body's like immune system and cellular health, how do we know that we're not also boosting the health of the cancer cells? So, we're trying to kill off cancer cells that are rapidly dividing. But if we're giving vitamins and supplements and antioxidants, like what are those doing to the cancer cells? Are they making them more robust and strong? And then
Hmm.
there's not a huge amount of information about how these vitamins and supplements actually interact with the chemotherapy themselves. There's a lot of supplements that change the metabolism of the liver and different things.
Hmm.
So in general, for oncologists and the doctors, they just kind of stray away from it. Although some of them say that you can take the vitamins, but not for 24 hours after chemo, and they have specific ones they don't want you to take. But I think in general, and it's seems to be more accepted now, is integrative medicine that goes along with your chemotherapy to support the
Hmm.
patient. I know Duke and MD Anderson, a lot of them have their own integrative oncology specialties. And I think that's really for chemo patients. If you're going to try to support your body through vitamins and supplements during treatment, that you really want professional guidance.
Absolutely. Absolutely 100. It sounds like for the most part, it's erring on the side of caution. If you're going to be in chemo for 3 months, don't take the supplements
Yeah.
unless you've got some specialized plan. No, I that makes total sense. Thank you for explaining that. Especially, when you've been given a diagnosis and you're making all these big decisions, right? And it's all unknown and it's so scary and your mind is just everywhere to sit there and try to process that. I mean, that makes total sense, but in the moment, you're not thinking about that.
Yeah.
You're thinking about hurry up, let's do something, get rid of the cancer, right? That makes
Yeah. And
total
there's so
sense.
much information on the internet, and inevitably patients start surfing the internet, and
Yeah.
that information can be broad, and it can be misleading, and it can be scary, and it can be comforting. Like it just depends which site you
Yeah.
land on.
Absolutely, absolutely. So Dermavitality was created, that's like the creams and the lotions and things. So
Yeah.
let's talk about that.
So so I was actually Leslie's nurse when she went. My
Oh,
business
nice.
partner actually was her nurse, and then
Okay.
so we started the company together, and we're in the supplement space. And because of the challenges with vitamins and supplements during treatment, and we are also were thinking, okay, well, let's help people restore their body after chemo, which we still are doing through diet and supplements. But one thing I noticed is the stuff that people were putting on their skin for radiation to start
Yeah.
out. And I noticed it just didn't seem to work. They still had skin breakdown. They still had red, itchy, irritated skin. And
Hmm.
so Leslie and I were talking, and I was like, hey, maybe we should try to make a cream that helps people with radiation therapy.
Right.
And so we ended up meeting, and I had this relationship with a gal in Arizona who's a natural and organic formulator in the beauty space. And so we talked with her and we researched all the evidence on the internet. And I basically said, here's the ingredients that really seem to work: calendula, hyaluronic acid, and some other ingredients. And I said, I just want you to make it better. Like make it as good as you can. And so she
Hmm.
helped us formulate that and came up with a basically for the radiation burn relief cream. It is a combination of ultra moisturizing ingredients like shea butter and
Hmm.
things that you traditionally think of for your skin. And then what we did, we added a whole bunch of anti-inflammatory botanicals to it. And they're very
Hmm.
small amounts, like less than 1%. So our
Okay.
creams moisturize your skin and they calm the reactivity and the inflammation. And
That makes perfect sense.
yeah, in all honesty, we just did our best. And I also have a expertise in Amazon, and I put it on Amazon, and I didn't know exactly how it was going to work. We thought it was going to work really well, but then the reviews started coming in, and everybody was like, "Oh my God, thank you! This is really great." So it just has taken off from there, and basically we decided to kind of address skincare head to toe naturally and organically without parabens and phthalates and all the bad things that you want to put in your skin. Because
Hmm.
people don't realize everything you put on your skin absorbs in your body.
Yeah.
So we decided to make safe and effective products that work for oncology patients from head to toe for chemo and radiation.
Yeah, I have written down here. I know there's a radiation relief cream or spray. There's the oncology body lotion. There's a face moisturizer, hand and foot calming cream, soothing scalp cream, and lip balm. Am I missing anything? That you've got it head to toe right there.
Yeah, well, we made an unscented version. So,
Uh-huh.
our creams contain some therapeutic grade essential oils, and we researched these oils to find out what they work for. And lavender works really good for burns.
It
And
really
so,
does.
yeah, and so we added that lavender to it. But then, as a nurse, I know that some patients that are getting chemo
Mhm.
can be nauseated and they're very sensitive to smells. In addition, doctors just say nothing with a fragrance, but they're not maybe aware exactly of the difference between a fragrance and a therapeutic grade essential oil. So we
Right.
made the unscented version for those that are sensitive to smell and also just to kind of address that gap with the doctors.
That's a great point because I'm flashing back to chemo. It's like some of your senses are taken away and the others are heightened, right? So you can't taste anything like it used to taste because everything tastes like metal. But boy, can you smell everything.
Yeah.
And what used to never bother you, and I'm talking about waiting in line at the hospital for your prescription, and the sweet little 78-year-old lady who's got perfume on walks by where normally you wouldn't even notice it and now you're gagging, right?
Yeah.
I don't know what that is, but you that's a great choice to have an unscented for that purpose, if nothing else. But lavender, I can't say I use essential oils every day. I diffuse them, I sleep with them, I use them the minute I start to feel sick. I'm layering on the soles of my feet, um, and I use lavender for burns all the time,
Yeah,
and
that's great.
it works. It works. So I know when I first chatted with Leslie, when she told me that, I was like, oh, I love it. And we've gotten samples, and you graciously sent me a ton of product, and I love it. And I've given away at the Care Project. Of course, we have our survivor socials. We've been having them monthly, and we'll be going to quarterly, but we are in touch with everybody who's in treatment on a monthly basis. And we did send home two patients with full size bottles at our last social, and then we have another one this coming Saturday. And so we will be checking in with those in radiation. So I'll make sure I get their reviews for you. But so far, verbally, they all love them. They love
That's
them.
great. I mean,
Yeah.
that's the best. All the reviews on our website are really amazing. And like for me as a nurse, like I said, I just want to help people. This is such a nice extension of my nursing because
Hmm.
when I see reviews and patients say, "Oh my God, this was the only cream that helped. Thank you so much. I was so miserable." It makes me feel, really great to help people. And if I can have a business and I can help people, that's like kind of a win-win for me.
That's it right there. That is it right there. I have my nonprofit, the Care Project, but I also now have a new business called Care and Beyond Consulting, and I'm doing end of life care companion and death doula work along with some other nonprofit consulting, as well as sort of moderating, if you will, like family meetings to advocate for the patient, right? So it's just another way for me to extend caring and advocating for patients like myself from a patient's perspective, right? But it's separate from my nonprofit. So I thought, I've given 8 years of no salary taking to my nonprofit. I'm going to create a little side hustle, but I still serve patients that I deeply care about, because it sounds like you and I are the same in that we need to feel like we're making a difference in whatever it is we're doing.
Yeah. Well, it's just as a nurse, and I am a male, but my mom was a nurse.
Yeah,
And so it's just kind of it's in my nature to do that. And
absolutely.
so I'm just kind of, I also decided to be a yoga teacher, which is another way that I can help people.
Yep.
So I just like, it's just something that's in my nature, as whatever
Yeah.
you were born here to do. So,
Yeah. Yeah.
and we did make some essential oil, like little nasal inhalers too. They're like personal chapstick looking things that help with
Hmm.
nausea and sleep and also relaxation. So yeah, we're really excited, and I'm super excited. It's working. Our hand foot cream is for hand foot syndrome for people
That's
that.
what I was, yeah. Talk about that, because some folks don't even know. If you hear a cancer patient talk about it, the people that they're telling this to are like, "What are you talking about?" They have no clue. Can you explain what that syndrome is?
Yeah, well, so it's like an inflammatory syndrome, and like in breast, metastatic breast usually gets called capecitabine, which is also known as Xeloda. And so it makes your hands red and they dry and crack and they get really irritated. So
Hmm.
this formula seems to be working just as well as the radiation cream. When people start using it, they can't believe how much better their hands and feet feel. So we're super blessed that that one worked too.
I love that. I have a friend named Heather who has been on the show several times. She's metastatic, and she has been on every chemo, including Xeloda. And I'll never forget the day she texted me some photos and she said, "This is a warning. This is going to be graphic. I can't get out of bed to even go use the bathroom." I said, "What is happening?" And she sent me photos of the soles of her feet and the palms of her hands, and they were completely red and blistered, and
Yeah.
she couldn't walk. I said, "Oh my God, what is that?" She's like, "It's from the chemo." I'm like, "Oh, I mean, what do you do?"
Well,
I mean,
usually if it gets that bad, they have to have you pause a little while.
yeah, right. But then in the meantime, you got to wait for it to heal up. So to be able to have an effective cream like yours for that, awesome.
Yeah, and we really
Fantastic.
are trying to educate our customers to use this, before it gets that bad. So,
Hmm.
in general, for our radiation patients, if they use the cream about a week before and they use it throughout treatment, it is really preventing radiation dermatitis. And we get a lot of reviews that say my doctor couldn't believe how good my skin looked at 5 weeks. So, and
Right.
same with the hand foot, if you start using it before it gets bad, you're really nourishing your skin with these ingredients and calming the inflammation before it even gets going.
That makes perfect. It's like getting ahead of the nausea, right? It's
Yeah.
proactive. Yeah. So let me ask you this: with radiation and using the cream, I know when I was going through, I had 5 weeks, and when I went through radiation, of course, I didn't know anything about this. This was 10 years ago, but they wouldn't allow you to put anything on your skin before you go in, and then you go in and you get your zapping, as I call it, and you leave there and you go home, and it was then that I would put something on when I found out about something, which was simply Aquaphor. It wasn't something specific for radiation, and it helped a little, but when the skin broke, it broke. What are you going to do? So is that how you would say to use this cream? Use it after you get your treatment?
Yeah. So we, the good thing about this cream, like if you, as you notice, if you've used it, when you put it on within just a few minutes, it's completely absorbed. So
Yeah.
it really absorbs fast. But yes, we recommend not to use the cream at all for at least 1 hour before radiation treatment. And then you, in general, use it 3 or 4 times a day. You can use it more if you want. It's not like harmful to put it on your skin and keep moisturizing the area, but yeah, that's the way we ask people to use it for sure. And that's basically the clinical guidelines for all skin moisturizers, is not to put it on before treatment. And Aquaphor seems to be like kind of the standard of care, and it's fine. But one nice thing about our cream versus that is that, like Aquaphor, you literally have to wipe off because it's kind of goopy and it's like petroleum jelly. Ours is already absorbed, so that sensitivity is you don't have to deal with that part.
Yes. And that's what I was going to say is when you sent me samples the first time before I got the full size, I opened one right away and tried it on my own skin. And I was like, oh my gosh, it doesn't just sit on top, right? Because a lot of lotions and creams, oh, they feel good for a minute. And then you realize like, oh, it's still just sitting there on top, and that's what Aquaphor does. For me, Aquaphor was it was a barrier at the time, when for anyone who hasn't had radiation, what it feels like as you get on further into, it builds up. So week 1, I was good. Week 2, I was like, it's a little tight, kind of like I almost got sunburn, right? And then week 3 and 4, it's like, oh, that feels a little bit like a sunburn. And by week 5, I had a gaping hole in my armpit.
Oh my God.
And I was burnt. I was literally like a blackened chicken wing underneath my armpit. It healed very quickly, but they were very aggressive with radiation for me. Again, 10 years ago. So maybe things have changed some. But leading up to that point, the Aquaphor and the people I know that use it, it was like a barrier between your clothing after you were done with treatment and you went home and you had to wear really loose clothing because your skin was so tight and painful. It just created that barrier. But what you just said is not having to rub it right on, because with your cream, it just goes on smoothly and it absorbs in. It's not something you have to really actively rub your skin like you would an Aquaphor or something like it. Does that,
Yeah.
yeah, yeah,
And even for patients, so patients are either using it, before, or they're using it for rescue when it gets so bad they're like, oh my God, I need something. So we made that spray because sometimes, like towards the end, it gets so bad that you don't even want to touch it. So the spray is really good and it works. It's working really well. The reviews are really good. People love it. And it's also good for areas like anal and rectal cancer patients where it's kind
yeah,
of not so comfortable to put creams on. So
right.
we made that spray to make it more convenient. And yeah, that is making patients more comfortable too.
Right. No, makes perfect sense. I'm glad you brought that up because I forgot to go back to my question about why the spray. That makes perfect sense. Perfect sense. Oh, I love that. I so appreciate you guys for creating these products and sending me all that you have. I will make sure I get them out to everyone and anyone who needs them. And we will have the link. It's dermavitality.com, right?
Yep.
Dermavitality.com. We will put that in the show notes. I will blast it all over my social media. And is there anything else that you want to tell us about or we should know about?
I guess the biggest thing is, for us, the biggest challenge is like we're getting it in the hands of nurses and doctors, but like a lot of doctors, they're afraid to try something new,
Yeah.
and we're just trying to get hey, just give this to your patient when they're miserable. I promise you, this is like going to really help them, and once they start doing that, it's great. We're also working on trying to get a clinical trial with Florida Cancer Affiliates and Panama City, Florida. So we feel fairly, actually really confident that we're going to get great results from that. And that's what we need for the oncologists, the radiation oncologists. We need to show them data that, hey, the patient's quality of life is a lot better. This is minimizing treatment interruptions and preventing radiation dermatitis. And so that's kind of like the next step for us to be able to do that so we can get, clinical proof that it's working.
Absolutely. Absolutely. Well, the next time I'm still followed by my oncologist, even though I'm 10 years out, I see her every 6 months and she sends me lots of patients that need support to the care project. So I'm going to take her a bottle too and let her check it out and see if she's interested in getting some samples in over at the hospital. I will do my part for you because I do love the product. I love that it's all, you know, it's natural. It's natural, it's cruelty free, it's paraben free. And as a cancer survivor, if I grew up in an era where we didn't even know anything about that, right? We laid
Yeah.
in the sun with baby oil and fried ourselves and now we're all much more aware. And so there's no excuse for people not using a natural product when there's something available. So thank you
Yeah.
so much. Thank you so much for what you do, Mark.
Sure, and let us know, if you have some patients that need it. We also have a patient assistance program for underserved patients, and we also give a lot of donation with some of our partners, breastcancer.org and National
Yeah.
Breast Cancer Foundation. Some of
Yeah.
those guys are our partners, and we're trying to support patients where we can, and grow our brand, and also be supportive just in general of cancer patients.
Yeah. And we'll talk offline about that.
Okay.
Because that's exactly what I do with the Care Project. I'm helping patients pay their bills. And so I'm happy to purchase whatever I can for them and within our budget and pass it along. So, but we will talk. We will talk more, sir.
Okay.
All right. Thank you so much, Mark. I will talk to you soon.
Okay, great. Have a nice evening. Thanks a lot.
Thank you. Take care.
Thank you for listening to Handle with Care, Cancer and Beyond. Please let us know what you think of the show by leaving a rating and review. And don't forget to share it with a friend. For more information or to connect with Carrie, go to thecareprojectinc.org.
Can you have zero interest in something and still really want it? Your wallet would say yes. And with Simply Zero from South Carolina Federal Credit Union, you can transfer credit card balances and get 0% intro APR for 12 months. That's right, no interest all year. So you pay less and keep more. To learn more, visit scfederal.org/simplyzero. That's scfederal.org/simplyzero.
Variable APR ranges from 11.74% to 17.99% thereafter. Limited time offer. Restrictions apply.
Are you ready for a rewarding career in the electrical industry? Quality Electric of the Coastal Carolinas, QECC, is looking for qualified electricians and electrical helpers to join its Charleston team. QECC offers guaranteed full-time hours, make up to $30 per hour with possible performance bonuses and career growth opportunities. Enjoy benefits like health insurance, dental and vision coverage, 401k plans, and more. If you're a motivated, experienced electrician, this job is for you. QECC is an equal opportunity employer. For all job inquiries, send email to hr@qeccinc.com.